So by the end of this session, we expect to achieve the following. Okay. So we expect that by the end of this session, we'll get to know what study leave is. We'll get to understand the importance of study leave, the importance to you as a nurse or as a midwife, and the importance to the agency or your employer as well. We'll get to know much about the types of study leave. We'll get to know the salary structure of nurses and midwives in Ghana. We'll get to know how to increase your chances of getting study leave. We'll get to know the common mistakes that can prevent you for getting provisional study leave. And even after getting provisional study leave, there are some few mistakes that you could do that could end up making you relinquish the provisional study leave that you had. We will get to appreciate all these things today. We also get to know how to successfully apply for study leave. That is you going to the portal and you being able to access it. We'll get to know the processes involved in study leave. Probably you might hear of study leave. It is not just a one thing. It's not a one day thing. After you get into the portal, you have to follow through a series of process that could take you even a year or more. We'll get to appreciate all of that today. We also get to know how to avoid some common pitfalls or some common mistakes or errors that could actually affect us badly. So, when we say study leave is an official permission that is granted by an agency or an employer. And here, the agency could be Ghana Health Service, it could be CHAG, it could be teaching hospitals, it could be the Amedia, it could be any implementing agency of the Ministry of Health. It could be Ministry of Health itself. So they're giving an official permission to an employee to pursue further education in order to, improve their qualification with the purpose of ensuring that they'll be able to improve the quality of care that is being delivered at the various facilities to the benefit of the district, the region, and the country as a whole. But the key thing about study leave is such that if you are giving study leave, you wouldn't be at work. However, you still remain as an employee of the agency or your employer. So you could be away for 6 months, 1 year, 2 years, 3 years, and you still remain as an employee of that organization. So, what are the benefits of study leave to the nurse or midwife? As a nurse or midwife, if you are granted study leave, it will improve your salary and allowances after you are being upgraded. So, as an enrolled nurse, if you are granted study leave and you further your education to become a degree nurse or a nursing officer, what it means is that your salary will increase. Very soon, you get to know the salary levels or the salary scale of an enrolled nurse as compared to that of a nursing officer. Okay. And in certain facilities, if you have a particular grade, you are entitled to some allowances. And so this could help you in that regard to better your career prospects. So, with most of the nurses or most of us in managerial roles, sometimes you need to have some qualifications in terms of management, in terms of governance. So, this could be of benefit to you. So, if you want to become a district director, you want to become a regional director as a nurse, you might want to pursue certain programs that could give you that opportunity. These days, if you want to become a DDNS, it's now called DCNO, you need to have a minimum qualification of a degree, not just by you being promoted from, let's say, a staff nurse to a nursing officer, but you need to have an academic qualification as a nursing officer from a university before you will be promoted to the rank or the position of a DCNO.
So, so, sorry, sorry. Please, let's mute our mics. because I can. There's some constant interruptions or noise from the background. I'm actually struggling to figure the person out here. But let's work on the mic.
I
Just
think.
tap on the mic, and when that cross line is on it, it means that you are muted. It will help us a lot. Thank you very much.
All right. All right. Okay. Thank you. I think Ahmed. Ahmed, your mic is on. If you could mute it for us. Okay. So as I stated, I know some of us, it's in our dream that, oh, one day I want to become a DC and a DD. I was speaking to one of our colleague nurses who expressed that she wants to become a DCNO. That is her dream. But as it stands today, okay, you need to have a minimum qualification of a degree before you can stand a chance of even getting such a position. Yes, so if you are granted study leave, it could better your career prospects. Okay. You could also want to become a nurse specialist. You might want to become an emergency nurse, a critical care nurse, and so getting study leave could give you that opportunity and greater job satisfaction and motivation. You see, sometimes we are in facilities where we feel there are some things that we can do to improve the healthcare delivery or even save a patient life. But because you don't have the qualification, you can't do it. And if you are unfortunate and you do that and something else happens, you could be taken on because you don't have the qualification. And so sometimes you feel like I need to have this qualification so that I can do ABCD. So study leave could give you that opportunity. And you could also have an opportunity to contribute more meaningful to patient care. I think I've explained that already. Now, how does study leave benefit our employer? That is Ghana Health Service or Child or Teaching Hospitals or which any agency you work with it. Now, it ensures that we have highly skilled workforce to meet the changing health demands. You see, these days, the patients we are dealing with, they are more informed. And these days, we have a lot of complex conditions. Some people will tell you because of the kind of food that we eat these days and all that. And because of how complex the health dimension has become, we need to be well informed. We need to work with evidence base. We need to do more of research. And unfortunately for us, some of the research that we did back in college, um, I might say it's not enough for you to be able to carry out case report or even do clinical research to improve, healthcare delivery. And so the agency will want us to improve our knowledge, our capacity, so that we'll be able to provide highly skilled healthcare service to the people of the country. And the agency also benefits from it in a sense that it helps to address the specialty gaps. We all know that in most of our facilities, especially in the
Mr. Simon,
peripheries,
hello.
yes,
Mr. Simon, please, that line, I couldn't get that part. I think your line was breaking in between.
okay,
And please, Mr. Adam, please mute yourself because you are distracting what the facilitator is taking us through. Please, thank you.
all right. So I hope my line is better now.
Yes, please.
Okay, so I'm saying that you see, these days people come to our facilities with complex conditions. Okay. I remember I had a colleague who was a prescriber. He could tell you that a patient will come and tell the history. You don't know how to even diagnose the case. So, because of some of these things, the agency has realized that if we are able to further our education, if we're able to build our capacity, okay, we will be able to provide highly skilled healthcare delivery to the people. Because the fact of the matter is that the curriculum for an enrolled nurse is different from the curriculum of a degree nurse. The curriculum of an emergency nurse is different from the curriculum of a staff nurse or a nursing officer. The curriculum of a critical care nurse is different from that of an emergency nurse. And so you need this diverse of skilled workforce to be able to meet the current complex health issues or health conditions we are having these days. And so the agency will benefit from it if it have most of the nurses specializing. I hope it's better now. And the next point is saying that it helps to address the specialty gaps. And as I was stating, in most of our peripheries, like you go to the chips, there are some towns that there is no midwife. You have enrolled nurses, you have community health nurses who are doubling as midwives. They are sacrificing, you are overworking. You see, so the agency will want to bridge these gaps. And so they will intentionally give out quota for nurses and midwives who are enrolled nurses or community health nurses to go and then pursue midwifery, to go and pursue critical care nursing, to go and pursue emergency nursing, so that they will bring back that knowledge or that skills to improve upon the healthcare delivery in the various facilities we have. And I want to believe if I ask most of us, how many emergency nurses do you have in your facilities? The numbers will be very less. Because I know of a tertiary hospital that even have just three emergency nurses. A big hospital in the entire country, tertiary, a teaching hospital, that has three emergency nurses in a particular critical department, and that is not good. And so the agency will want to train more people as emergency nurses, want to train more people as critical care nurses so that they can bridge those gaps. And I also want us to understand that if you take every facility, whether it's a CHIPS, a health center, a polyclinic, a district hospital, municipal hospital, a teaching hospital, we have what we call staffing norms. And the staffing norms actually categorizes the number of enrolled nurses you need to have in each facilities, number of degree nurses, number of community health nurses, number of PAs, number of doctors, and all that. So when they open that gap or that system, they'll be able to know that we are supposed to have, let's say, 10 enrolled nurses in, let's say, Mampong Health Center, but currently we have five. So we need five enrolled nurses to fill this gap. So this is some of the things that the agency will benefit from. And it also improved the quality of healthcare delivery at all levels, which I think I made mention of it already. It enhances the staff retention and loyalty when nurses see opportunities for growth. As I speak with you today, almost every nurse wants to travel outside the country. You see, if you speak with some of our senior colleagues, those that have been in the service for years, they'll tell you, my age, but may apply for study leave, I am family. And that kills the morale. Okay, it prevents people from wanting to stay in the service. But if I know that as a nurse, if I start working within 1 year or 2 years, I'll be granted study leave to go and do my BSc or do my master's or do my membership or fellowship, then I want to stay because in as much as I'm increasing my knowledge, I'm also increasing the salary that I'm taking. I'm also increasing the allowances that I might be able to enjoy. So these are some of the things that the agencies also benefit from it. Now we move on to the types of study leave. I know we all know what study leave with pay is, which is the common one we are all yearning to acquire. So when we say study leave with pay, it simply means that you will be absent of work, you will be in school, and you will still be paid. So if you are in school for 6 months, every month you'll be paid whilst you are schooling. If you're in school for 1 year, you'll be paid every month whilst you are schooling. If you're in school for 2 years, 3 years, you'll be paid every month. So it is as though you are at work, but you are schooling. That is what we mean study leave with pay. When we talk about study leave without pay, it means that you won't be at work, and whilst you're not at work, you are not going to be paid every month. That is study leave without pay. Study leave with pay, whilst you are in school, every month you are paid. Without pay, whilst you are in school, every month you are not paid until you are done and you are back to your facility. Now, what are the salary structures of nurses and midwives in Ghana? This is a very important slide that I want us to take notice of. As we speak today, if you open the public sector salary structure, if we look at the single span salary structure of all public sector workers in Ghana, the apex, the highest paid rank or grade is a consultant. Okay. And so in nursing, our highest paid rank, okay, is a nurse consultant. So you can see that a nurse consultant is on the salary scale of 23L. A senior nurse specialist is on a salary level of 22H. A nurse specialist or a chief nursing officer. And I hope we all know a chief nursing officer, who that person is. So when you go to your region, you have a chief nursing officer who is in charge of all nursing activities in the region. So in every region, we have one chief nursing officer. And so far, Geronimo is trying to work very hard with our implementing agencies to decentralize that, such that we can have a lot of chief nursing officers at even some of the district hospitals. So that work is ongoing, and I hope it gets actualized very soon, because it will increase the salary levels of our mothers and our dads. Because you see, the chief nursing officer role is a position that can only be appointed for. You can't be promoted to a chief nursing officer as it stands today. At first, you couldn't be promoted to a deputy chief nursing officer. You were supposed to be appointed, but GRNMA worked so tirelessly, and now you can be promoted to the rank of a chief nursing officer. We are hoping that that will be expanded to the chief nursing officer, and I hope that is done soon. So that is the salary scale of a deputy chief nursing officer. Until DD in the salary level A22H. Okay, your DCN or your directors, those are their salary levels. Principal nursing officer, they are on 20H. Senior nursing officer are on 19L. Nursing officers are on 18L. Senior staff nurses are on 16L, and staff nurses are on 15 high. So if a diploma nurse starts working today, your salary scale or your salary level is 15H. It continues until the highest, which is 23L. Then we move to community health nurses. So you realize that with the community health nurses, if you start as a community health nurse at the base, your salary scale is 12L. A senior community health nurse, your salary scale is 13L. Principal community health nurse, your salary is 14H. Superintendent community health nurse, your salary scale is 16H. It's similar to an enrolled nurse. So enrolled nurse is 12L, senior enrolled nurse 13L, principal, and that's in that order. So if you check your pay slip, you realize that these are the salary levels on your pay slip, and you have your point as well. Then we move on to what we can do to increase our chances of getting study leave. Now, before I dive into deep with this, let me take you back to the salary structure again. You see, the higher the values, the higher the salary the person is taking. So let's take notice of that. So you realize that a senior staff nurse, diploma nurse, our age maybe 3 years or 2 years, if the person is working in a deprived place, is taking the same salary as a community health nurse who has been working for about 15 years, or an enrolled nurse who has been working for about 15 years plus. So let's take note of that. So, what can I do to increase my chance of getting study leave? One, you need to have served the minimum number of years that is required of you by the agency. And currently, we have what we call the deprived districts and districts that are not deprived. So, if you look at your region, there are some districts that has been categorized according to Ghana Health Service that they are deprived. So if you find yourself in those districts, the number of years you are supposed to serve before you become eligible for study leave will be reduced by 1 year. For some of us who are working in the urban areas or in the district that are not categorized as deprived, we are supposed to work 1 year extra. So if you are a community health nurse today, before you will be eligible for study leave, you need to serve for a minimum of 4 years. That is if you are in a deprived district. If you work in a district that is not deprived, you need to serve for 5 years before you'll be eligible. If you are an enrolled nurse, 4 years in a deprived district, 5 years in a district that is not deprived. If you are a staff nurse, you need to work for 2 years in a deprived district, or 5 or 3 years in a district that is not deprived. Likewise, a staff midwife or a registered community health nurse. That is the diploma that I'm talking about. If you're a nursing officer or a midwifery officer, you are supposed to serve for 4 years in a deprived district before you become eligible to be able to apply for study leave, or 5 years in a district that is not deprived. Now, if you meet this criteria, then we move to the next point, which is choosing a priority course. Now, as I spoke about then staffing norms, every health center, there is a number of nurses you are supposed to have, a number of community health nurses, number of enrolled nurses, number of staff nurses, number of midwives, number of PAs, number of doctors. Okay, so your district and your region will analyze these gaps, and they will be able to drive what we call quota for the entire region. So the region will know that in this region we are lacking 15 enrolled nurses. We are lacking, let's say, 50 nursing officers. We are lacking 30 critical care nurses. We are lacking 40 emergency nurses. We are lacking nurse specialists in that regard. And they'll, based on that, to give you the quota. And I don't know if some of you have seen the quota before, but I'm hoping I'll be able to open Western region quota for you to see. They will tell you exactly the number of nurses that need to go to school this year. So if they need 10 nurses to do degree in nursing and you are 20 people who are applying for it, it means 10 of you will not be granted study leave. It is only 10 that you go through. If they need 15 degree nurses and you have only 5 applying, all the 5 will get the study leave. If they need 15 and you are only 10 people applying for degree nursing, all the 10 of you will get a study leave. So you need to understand, or you need to get to know the quota, and that can help you to choose the course that will increase your chance of getting the study leave. And let me also let us know that based on the number of quota or the quota that is available, they will now have to look at the number of years you've served. So if we have only 10 slots for degree nursing in Mapon Municipal, and we have 15 people applying, they'll start looking at the number of years you've served. If somebody have been working for 10 years and the person wants to do degree in nursing, and you have been working for 3 years and you want to do degree in nursing, they'll give the slot to the one who has been working for 10 years because you just started. It's like a queue. Now, the other aspect has to do with you maintaining a good record. And that's, I mean, as a nurse, you need to make sure you don't have any disciplinary action against you when you want to apply for study leave. So if you're a nurse and you have a disciplinary action against you, that automatically will take you out of this opportunity. And if you fill the portal correctly and you submit your HR, you see, some of us, when we go to the study leave portal, we just do things anyhow. Sometimes we are in rush. Okay, I have received calls from a number of people that did one or two things that now they are regretting. When you open the portal, please take your time. Don't rush. Currently, we have about 26 days to be able to access it. And it is not first come, first serve. And you say, "Was wow, Obedi can I apply now, Obedi first." No, that is not how it works. So if you fill the portal correctly, you put in your correct details, it also increases your chance of getting study leave. Because let's look at it this way. If the region wants only degree nurses and you go and select fellowship, automatically fellowship no wunya because the district or the region doesn't want any fellowship. So you won't get it. Okay, if you enter the school you completed wrongly, that could affect you. So let's take notice of that. And if you are somebody who have already enjoyed one study leave, you need to make sure you indicate that when you are filling the portal, because if you don't indicate that and they are vetting the applicant, they might find a problem with you and then you might be taken off. Now, let's look at some of the common mistakes. I think I've made mention of some of them. So, most often, when we just hear support on ABA, people are rushing. Any email, they just go and then they enter it into the system. No, please take your time. Somebody told me that the email no started with www.bbbb answer. Email doesn't start with www. So please make sure you always have your correct and active working email address before you even visit the portal. So I do normally advise that before you visit the portal, check your email, log out from your phone and log in and see if you have the password. If you're not sure, change your password and make sure you have your correct email, your correct password. You can also decide to write it down before you even go to the portal. Next, people choose wrong courses, which I stated. Somebody as an enrolled nurse will go and choose that he want to go and do associate nursing. An enrolled nurse, you can't do associate nursing because before you can become an associate member of Ghana College, you need to have at least a diploma. So if you have a certificate and you go and choose associate nursing, if automatically if the committee finds that out, they won't grant you the study leave. You'll be out. Applying for unaccredited institutions. So we have some schools that are not accredited. So after applying for the study leave, we have what we call the provisional list that normally comes out. And this year, after somewhere October, it might come out somewhere November or December or early January. You might see your name there, okay? But after doing that, if you go and put in the wrong institution or school that is not accredited, and then the vetting committee finds that out, your study leave could be taken away from you. So even though you were granted provisional study leave, but you could still lose it. Note the word is provisional until it is finally approved by the Director General. Also, not completing the mandatory years of service. Yes. So there are some of us these days it's even better. At first, when you go to the portal, you could just enter anything and then you are good to go. But today, the portal has been sensitized in a way that if you have not served the minimum number of years and you try to select a course, it won't allow you to choose that program. So these days, that problem is solved. But you need to let's make sure that you have served the minimum number of years. Um, Poor documentations, I think I spoke about that. Late application submission. So this late application submission is not about you entering the portal first or last. It's about you submitting the hard copy to your HR. You see, after visiting the portal, after entering everything, you have to print it out and you have to sign. There is a place you have to sign and write the date that you signed and submit it to your human resource, that is your HR. And then your HR will submit it to your MedSoup or your district director for endorsement, and they'll forward it up to Region International. So if you don't do that, you will not get the study leave. So let's take note of that. Not completing your bond form. You might be granted this provisional study leave, but if you don't complete your bond form, your final approval will never be given. Okay, and even there are some people that they will apply, they've getting the provisional study leave, and quickly they go to school, they don't fill the bond form. At any point in time, the agency can take the study leave from you. As far as you've not gotten your final approval, they can take it from you. And what it means is that if you had been in school for 6 months and they relinquish that study leave from you, you are supposed to come and serve a bond of about 6 months or more because you were out of work for about 6 months. So let's always ensure that we will complete our bond form. That is if we receive the provisional approval. Not getting your final study leave approval letter. So you get to know that when you are granted a provisional study leave approval, you have to do a number of things. You have to sign some bond form, fill some number of documentations before you get what we call the final approval letter. If you don't get your final approval letter and you go to school, your study leave can be taken away from you. And so all of us on this call, we need to ensure that eventually if we are giving the provisional study leave, we must ensure that we get our final study leave approval letter. So let's keep notice of that. So how do I apply for the study leave? Now that I know the minimum number of years I need to serve, I know the common mistakes that people might do that might prevent them from getting study leave. How do I apply? So this is what you need to do. A link will be shared. I'm sure your chairman will share that link with you. When you click on the link, it will ask you to register. Okay. So first and foremost, your email and your password is key. So you just come down. Let me see if I can open that for you to see quickly. Um, Okay. So I hope you can see we have declaration of intention for approval to pursue further studies. Can you see it?
Yes, we can see.
Good.
Yes.
So when you tap on the link and you see this, you have to scroll down here. The first thing you need to do is to click to register. Okay. So when you click to register, it will bring you here. And here you enter in your staff ID. When you put your staff ID, it will pull out your bio data, the facility you work, your current grade, and all that for you to see. Okay. So let me see if I can demonstrate. Okay. One of you can give me your staff ID. Someone should mention the staff ID. Let's um demonstrate. Any one of you.
665 780.
66
5780.
5780. Okay.
Yeah.
So after putting your staff ID, you tap on proceed. So you can see that it brings out your bio data. So it tells you your agency, your region, the district, and the facility you work, your current grade. You see all that, and your full name. Okay. So when you get here, you need to make sure you put in your active phone number, and you need to make sure you put in an alternative number that you have. And then you put in your email. Please, I made mention that make sure your email is working, because if your email is not working, you will be in trouble. I repeat, you will be in trouble if your email is not working. So make sure you put in the right email, and then you create a password. Now, this password, if you forget this password, you will also be in trouble. So make sure you write the password down before you even put it in there. So they are telling you that the password should be between 6 to 12 characters. So that is clear. So when you go to the portal, that is the first thing you need to do. So you click to register, it brings you here, you put in your staff ID, you proceed, and then you see your bio data. Please always make sure you confirm every detail here. If there is a mismatch, okay, maybe your current grade is different, quickly reach out to your HR and that can be rectified before you proceed. Okay. So thank you so much for giving us your staff ID. All right. So after registering, you fill the portal. Okay. So use your accurate details. So um, I hope you could do that. Please, can we use your details, or you are not ready to apply yet? All right. So you
Please, you
fill the
can use it.
portal. We can use it. Okay. So but because of privacy sake, I think your password we can't share that. Okay. Um, but let's see. Okay. Let me just. Okay. So can you send me a hi on WhatsApp? This is my number: 0240 147 944, so that we can create your password of the screen. Okay. And then we can then share it. Okay. The number is 0240
0240
147
147
944.
944.
Yes. So just send me hi on WhatsApp.
Okay. Mommy, the Dario. Oh, do your mouth.
Okay. So let's move on whilst she reached out to me. So you fill the portal, and I made mention that you need to use your accurate details. Please, when you are filling the portal, to be on the safer side, you can pick your paper, write every detail down on a paper, and key them one after the other. If you know that you are not internet savvy, if you're not good with IT, please get your colleagues who are good. Okay, you can speak with your chairman or you can reach out to me any point in time, and we will assist you, because if you enter something wrongly over there, it will go a long way to affect you. Remember that the study leave is based on quotas. Okay, so if you enter some information wrongly and then the number of people applying for that program is more than the number they need, they won't waste their time on you. So please make sure you put in the right and accurate details there. After filling the details, you submit and print it out. So very soon, when we get her details and we fill in the portal, you realize that there will be an option for us to Okay, there'll be an option for us to submit on the portal. So after submitting, you have to print it out, sign, and submit that document to your HR. And as I stated, most of us often make the mistake of, oh, my submit here, okay, you don't submit it to your HR. Please, that can go against you. So please make sure we are printing. Internet cafe na printing. And if somebody did it for you, the person will send you the PDF. Then quickly go and print it, sign it, and submit it to your HR. Please don't forget that. Now, let's look at the leave process. As I made mention, the leave is not an event, it's a process. It can take about 2 years or 3 years or even 4 years. Okay, so this is what happens. Once this portal has been opened, you are going to fill the portal. That is, you are going to declare your intention that I want to do this program, I want to study this course. After declaring your intention, you submit your filled form to your HR. Then your HR will give it to your head of facility, which is the head of BMC, which could be your medical super or district director. They will endorse it and they will either recommend you or not recommend you. And I made mention that if you have a disciplinary action against you, they will just take it on the form, which means you are recommended. However, they will still submit it to region. Okay. When they submit it to region, we have what we call the study leave selection
Holiday.
committee. There is a committee that is set up to vet and approve study leave for the region. And so that committee will sit down. This is the committee that work with the quota. Okay. So they'll look at it and then Okay, so they'll look at it and then they will either approve you or not. So that is where they'll look at your disciplinary action that is against you. They'll look at the program you've selected. They'll ask, this program, is it going to be of benefit to the region? Okay. You say you have diploma. Do you really have diploma? They will do all those, assessment, and they will either recommend you or not recommend you. After the regional level, they will also forward it to headquarters, that is national. And then Director General, the HR department will also
No,
look at it
customer protection
and either
too.
approve it or not approve it. So that is the first process that it goes through. So after this process, you now get what we call the provisional study leave list. So this, as I said, will be coming out hopefully in December or October, November or December, or sometimes early January. So if you see that, you quickly
Hyundai.
cross-check your name.
Hyundai.
If you see
I
your
can
name
see
there, then hooray,
Sister,
you've
just a moment.
yes.
Sister Gloria, kindly mute for us. Thank you.
Hey,
Please, can I proceed?
Yes, please.
Okay. So when a provisional list is out and you see your name there, then it's almost like congratulations because you are true. Because quote an alpha. Okay. So if you see your name there, in fact, mostly when you see your name in the provisional list, it's like almost 80-90% done, but you are still not done. Okay. So if you see your name there, then you've crossed the most difficult part of the leave process. So after doing that, If you see your name, you go back to the portal and you use your email and the password that you created. That is why I told you that you need your password and your email for a year or two. You log in with that password and the email. When you log in, they'll be asking you to put in the details of your school. Okay. So if your school has released forms and you've bought the forms and you've been granted admission, you upload your admission letter. You state the school that you have selected. You state the program again. Sometimes the program might even be there automatically since it was selected already. You state the certificate that will be awarded to you. You state the duration of the program, when you are starting the program, when you are completing. You fill all those details. After filling those details, you submit it online. When you submit this on the portal, you will get what we call the bond form. So you only get the bond form after you fill the details of your school, the school you're attending, the course you're going to do. In fact, they even ask of the town and the district of the school. So you fill all those details. Then you can now get access to the bond form and you sign the bond form. You download the bond form, sorry, and you sign and endorse it. Now, this bond form, it has become very, very important these days because most of us, we pick study leave and we japa, we travel outside the country. That is what most of us have been doing. So these days, you see auditors coming in and out, going through your details with your HR. This person, where is his or her bond form? Was it duly signed? Was it endorsed properly? Where are the guarantors? Are they people that were actually properly, selected to be guarantors or to be witness? Because we are getting to understand that your witnesses should be a notary public. There should be a senior public officer of a rank that is not below administrative manager. So not just anybody can be a witness. The person should be at that level. The person could be a lawyer. The person could be your religious leader, could be an imam or your pastor. Okay. Or you need to get any of your management members. So I know people that you made their, nurse managers to witness their bond form. And let me caution as to if you become a guarantor, because you need two guarantors and two witnesses. So the guarantor, if the one who has taken the study leave travels outside the country without serving the bond, they will deduct the monies that the person is supposed to pay from your salary. So if you want to be a guarantor for your colleague nurse or midwife, please just know this. And if you are going to guarantee for somebody, please advise the person that money into kwan. Now say mpo so there is a process that you can pay back the money to government chest. Okay, so let me just take us through the bond. If you do any program, assuming you went to do associate membership for 1 year at Ghana College, when you are done with this program, you are supposed to serve 2.5 years bond before you are free to travel or leave the country. If you did a 2 year program, you are supposed to serve a bond of 3.5 years before you are allowed or you are cleared to travel outside the country. If you do 4 years program, you are supposed to serve 5.5 years before you are allowed to leave the country. If you've done the program for, let's say, 2 years and you've not served the bond and you travel outside, you have to calculate the number of years you were away from work and pay the salaries that has been paid to you with interest, the current state interest, to government chest. If you're able to do that, then your guarantors wouldn't find themselves wanting. And so maybe you were granted study leave, you did not intend to travel, you had an opportunity. Yes, you might want to travel, but please make sure that you pay that money back so that your guarantors wouldn't find themselves wanting. So after filling the bond form, you submit it to HR and make sure you upload it on the portal. So you fill the bond form. You need passport pictures, about two passport pictures of each guarantors, about two passport pictures of each witnesses that will be signed and stamped. You fill all those things. You snap it, you scan it, then you upload it onto the portal. After uploading your bond form, a final form will be given to you. You will download that form, You sign it, you give it to your HR. Your HR will give it to your head of facility or your district director. They will sign that form and they will send it to region, and that will be sent to national before you can now receive your final approval letter. If you receive your final approval letter, then it means you are finally through. You can go to school without any problem. Now, please note, once you get a final approval letter, make sure you download that final approval letter and give a copy to your HR and give a copy to your nurse manager and your unit in charge. These are the reason why you give a copy to your nurse manager and your unit in charge. You might be in school and they'll come around and say they want to do head count. They want to check some details. You might not be around. Okay. If your nurse manager has your final approval letter, because your nurse manager has the records of all the nurses and midwives, those on study leave, they account for you within every quarter. In fact, these days it's even every month. They account for you to the chief nursing officer at region. So your nurse manager can just pull your final approval letter and the auditors can have a look at it. And if probably your nurse manager is not around and your in charge is there, they can also use that, and then that could save you a lot of stress. So this is the process you have to go through to now say that you have your final approval. Now, I've already spoken about some of these things, but let's take notes. Please always make sure you have an active email. Make sure you have a correct password before registering. Remember to write your password and email to the study leave portal because you will need it for over a year, sometimes even 2 or 3 years. Okay. Ensure you meet the requirement. I already mentioned that. Seek mentorship from colleagues who have succeeded. So please, I know that in Ghana we are more secretive. Okay. I was taking one of our colleagues through the portal and he was like, in his facility, she doesn't know the number of nurses that are applying for study leave because no one is ready to share. Okay. But please reach out to your senior colleagues. Okay. Especially if you know somebody who has ever been granted study leave, speak to them, your senior colleagues, seek for their counsel, seek for their advice, especially the programs you want to go and pursue. There are some courses that if you go and read that course, when you come back, your salary will reduce. Okay, because I made mention of the salary level. Let me go back to that slide and then you look at that again. You see, if you are a superintendent enrolled nurse, your salary level is 16H. Okay, if you want to leave and you mistakenly, I say mistakenly because I wouldn't encourage anybody here to go and read diploma program. If you mistakenly go and choose diploma in nursing or diploma in midwifery and you complete, when you start working as a staff nurse or as a staff midwife, your salary will come down to 15H. Nti anka obi a wako square also sika ebi bɛka ho no, ɛso bɛsan so ayɛ den ate. So seek for counsel. In fact, you can even go through this salary grade system and make a decision. Don't just choose any program because everybody is choosing that program. I will send the single span salary structure to your district chairman and then he will share that with you. Any program you want to go and study, please take your time and look at the salary scale. So program na mekwa akoye. My current salary level, is it more than that program or not? If your current salary level is more than that program, please, it is not advisable to go and do that program. Okay. However, if you want to get your degree because you want to become a district chief nursing officer, or deputy chief nursing officer, you want to become a DD or you want to become a chief nursing officer, and then they are demanding that you need to have an academic certificate, fine. But if you are starting, please take this very, 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 very critical because there are people that were, enrolled nurses, so pretended they went to school, and after 3 years, their salary hasn't increased. It has even reduced. If you're not lucky and you get an HRR, they will just grade you and then salary will reduce. So please take notice of that. So seek mentorship, seek for counsel. Don't keep everything to yourself, please. It's very important. And then stay updated on official circulars. So you need to be very, very, active. Okay, be on your platforms. Your HRs will be updating you as and when there is any needed details. So please take those very, very important. You can also always reach out to your district executives or your facility executives, your sub-district coordinators, and they will be able to give you any current updates that are available. And please make sure you keep copies of all documents that you have submitted. In fact, sometimes you can even keep two extra copies because there are instances you might submit some document to your HR or the appropriate offices, and eventually they'll tell you, say, document no mun send ho." And if you don't have a copy, that will put you into a lot of stress. So please make sure you keep extra copies of all your document that you have submitted. Now, let me use this opportunity to talk a bit about Ghana College of Nurses and Midwives. Now, we have a lot of programs at Ghana College. So, I believe some of you have heard of Ghana College. So, anyone that goes to Ghana College, when you complete, you become a nurse specialist. I think this slide is not that clear. Let me see if I can um, share a better one here with you. Okay. I think I am not getting it. Okay, we'll have to make use of this. I'm not getting what I want. Let me see. Okay. Uh, is this better? Can you see the programs? I hope you can see the
Uh,
programs better.
yeah, not really clear, but we can follow you through.
Okay. Okay. All right. So, any program that we do at Ghana College of Nurses and Midwives, when you complete that program, it makes you a nurse specialist. And initially, when I opened the salary structure of nurses and midwife in the country, you saw that the highest paid nurse in Ghana was a nurse consultant. And that is not only with nursing, but almost all public sector institutions in the country. The highest paid rank is always the consultant level. So at Ghana College,
This is clear now.
this is better. Okay, good. So
Yeah.
at Ghana College, we have three main blocks of programs that you can do at Ghana College of Nurses and Midwives. We have what we call the associate membership, and we have what we call uh, the membership. So membership is between you do membership between 2 to 3 years. The associate membership is between it's just 1 year program, and then we have what we call the fellowship programs. That is for 2 years. Now, these fellowship programs makes you the consultant, whilst the membership programs makes you a nurse specialist. So, what are some of the programs that you can pursue at Ghana College? So, we have emergency nursing, which you can do associate membership for 1 year. We have nephrology nursing, pediatric nursing. I'll send this to your district chair and he will share that with you as well. Now, realize that they have eligibility criteria. So, before you can go and do associate membership at Ghana College, you need to have at least RJN or a diploma in nursing. You need to have worked for a minimum of 3 years after you graduated from college before you will be considered to read these programs. That is for associate membership. Now, let me make you understand this. If a diploma nurse goes to Ghana College and read associate membership programs and come back after 1 year, that diploma nurse will start taking a salary as a degree nurse. He or her and the degree nurse will be on the same salary level. But he did the program for just 1 year. If you go and read degree in nursing for 2 or 3 years, oba nipa okoye 1 year and you take the same salary. But mind you, Ghana College certificate is not an academic certificate. It is a professional certificate. That could just boost your CV. But untimi mfa associate certificate, say you want to use that to do your masters. No, it is not an academic certificate. And if you do the 1 year, even though your salary level will be as a nursing officer, okay, but you don't have a degree. Let's get that distinctions. So if an enrolled nurse, it means you are not qualified to go and do associate membership. If you're a community health nurse or certificate holder, you are not qualified. You need to be a general nurse, or you need to have a diploma in public health. You need to have a diploma in midwifery before you can be eligible to do any of these associate membership programs. Now we move to membership. And yes, you can see the membership. We have emergency nursing, hematology nursing, nephrology, neuroscience nursing, oncology nursing, palliative, pediatric nursing, and that and all. And you look at the criteria. You need to be a registered general nurse before you can do these programs, from emergency nursing up to orthopedic nursing. And you need to have a degree in nursing, or you need to be a nurse practitioner. So if you have a diploma, please don't go and select membership on the study leave portal because you won't get admission. You find out. So you need to have a degree, and then you need to have served 5 years post your qualification. So 5 years after you had a degree, before you be eligible to go and read membership. Now, very soon, when I'm done with this, I'll go back to the salary structure and draw your attention to something. If any nurse goes to Ghana College and read the membership programs, okay, and you are done, your salary level. So if you were a degree nurse, okay, let's say you move to a senior degree nurse and then senior nursing officer, and then you are around 19L, okay. Once you complete the membership program, your salary level will shoot from the 19 straight to 22L. Your salary will now surpass your district director, your DDNS. You'll be taking more than her. And you'll be taking the same as the chief nursing officer, your regional chief nursing officer, the one who is in charge of all nurses and midwives in the region. You'll be taking the same salary with that person. Just because of your specialty, you are now a nurse specialist. And these people are taking no less than between 7,000 to 10,000 plus at the end of every month. So I always tell people there are nurses in Ghana who are taking more than 10,000 as salary every month. So if you are young nursing, if you're a young nurse and you are coming up, you need to be eyeing some of these specialty programs at Ghana College. So we have infectious nursing. Infectious nursing, you see the criteria, degree nurse, you could be a public health nurse, nurse practitioner, you can do that. We have advanced midwifery practice. You need to be a midwife. You need to have a degree in nursing or midwifery. You need to serve for 5 years after you had a degree before you be eligible. Okay. We have neonatal nursing, either a registered nurse or a registered midwife. Okay. We have well woman care. So registered nurse, registered midwife, public health nurse. And the list goes on and it goes on. So if you have this slide, please take your time and go through and see if you qualify for any of the programs. You can just choose that. And if you are on core and then you are already a member, you have membership qualification, please, I will encourage you to go and do the fellowship, because currently Ghanaian nurses, we don't have a lot of fellowships graduates. And the challenge is that if you are reading membership or if you are reading associate membership, we need your colleague nurses who are in this field to be able to train you better. But since they're not enough, mostly this work is left to the medical officers, the doctors, or yeah, the doctors to be doing this. So please, if you are a nurse on this call and then you have membership, please try and then find a way and go and read fellowship for us. But you need just 2 years. You do it for just 2 years, and the requirement is that you need to be a member. You need to serve 2 years after you had your membership, and you need to be a faculty member or a minimum of 2 years in the field of internal. So please when you get a slide, please go through. This is very important. Okay. Open so usika samia kama as a nurse in Ghana, you have to be eyeing this because as a nurse, if you are taking 10,000, 15,000 a month currently, and should not bad, sir, but it's not perfect. Okay, so that is it for the Ghana College of Nurses and Midwife. Okay, so let's go back to the other slide. Um, I made mention of the salary structure, so we just get that so well. So remember, I made mention that if you go to Ghana College, you become a nurse specialist, right? So the nurse specialist, you could be an associate member or a member. If you are an associate member, your salary level is just like a degree nurse. So if you look at this slide, you realize that a nursing officer, your salary scale is 19L. 19, sorry, 18L. 18L. That is a nursing officer, degree nurse. So if you go to Ghana College and do 1 year associate membership, that is what you'll be taking. We need degree nurse, BGP. If you go and read membership, look at the jump. Okay. So let's say we're a nursing officer. Okay, you're a senior nursing officer, 19L. Okay, membership bar, you jump 20H, you jump 21, and you go to 22L. Now, if you become a nurse specialist, you are entitled to any form of allowances in this country as it stands today. If you become a senior nurse specialist, then you are the highest paid, nurse in terms of ranking in the country. If you read your fellowship, then you become the highest paid nurse in the country. So young nurses and midwives, let's eye for Ghana College and Midwives, and let's advocate any chance that we get so that they will increase the intake. I'll be showing you the quota for I think Western region, and you see the number of membership that they need. The numbers are just too small. So I'm hoping that we'll give in more advocates and the intake will be increased. So I want to pause here and invite questions and answers. And whilst I try to bring up the quota for Western region, just to as a guide. Okay. Now, um, okay. So if you have any questions, the floor is yours. Honorable Chair, over to you.
Oh, thank you so much, Mr. Simon. Thank you so much. This is very elaborate, and this is how we are going to do it. We are many here. Just indicate by raising your hand. If you look at the icons we have down, the tools we have down there, you will see some three lines. You can uh, see a place where you can raise your hand. When you tap the three dots or the three lines there, it will show you what to do. Once you raise your hand, we will call you and then either a clarification, a question, contribution, and then we proceed. Thank you very much.